Hello and welcome to our first edition of EC3 HOSA Medical Moments, a monthly program featuring knowledgeable healthcare professionals, guests talking about health topics and tips. Our show is produced by HCEC-TV with the talented support of our community health partners. I'm Haley Robbins.
I'm Shelby Miller. We are students enrolled in pre-nursing, phlebotomy, and pharmacy pathways at EC3. Also, Haley and I are co-presidents of EC3 HOSA, featuring health professionals, an organization to build leaders in healthcare.
Today's guests include two healthcare entities to share information on the importance of immunizations. Joining us is Tanya Williams from the School Nursing Director for Healthy Kids Clinic, and Julie Smith, and she's a clinic nurse at Lincoln Trail District Health Department. Can you tell us more about Cumberland Health?
So Cumberland Health is a program that has school health services in the school system. So every school has a school nurse, and then we also have nurse practitioners that comes into the schools and sees kids who are sick, who needs a well child visit, or if they need vaccinations. So if your child is not feeling well today, you think they might need strep testing, we can do strep testing, we can do flu testing, we can do lab work. So we're there, it's like a clinic for your children in school.
And can you tell us more about the health department?
Sure. I'm part of the Lincoln Trail District Health Department. Our district office is here in Hardin County, but we cover 6 counties. We have health departments in LaRue, Marion, Washington, Nelson, Hardin, and Meade counties. I work out of the Marion County Health Department. Public health involves so much, not only vaccines, but we have environmental services. They protect people against foodborne illness. They go into food establishments and inspect and do that sort of thing. So, and then we have multiple health educators that go out and educate the public on smoking cessation, obesity, anything that's going to impact public health. So not only do you have clinic nurses like myself doing vaccines in the clinic and handling things like tuberculosis, but you have environmental and other people in the background. So we're kind of behind the scenes, but we're there to protect everyone in our communities.
What vaccines are available in our school-based health clinics?
We offer all vaccines at school, but we also, in the community, we offer the tetanus shot, the Tdap, the pneumococcal, hepatitis A, hepatitis B, varicella. We offer all of them in our schools.
All right, and who all are available to receive these vaccines in school?
Everybody is available, or is available to get it. They all can receive the vaccines. They just need to get with their school nurse to see what they're missing and what they need.
Okay.
What types of insurance do we take?
We at the health department do what's called VFC program, Vaccines for Children, which is a federally funded program. It's for children who are enrolled in Medicaid or who are not insured or whose insurance may not cover vaccinations. And they have to be under the age of 19 for that program.
In the schools, we accept all insurances.
And then what are the required vaccines for school-age children?
Of course, you know, we start vaccinating infants in early infancy, and then they get vaccines at 4 years of age before they start maybe preschool or kindergarten. And then there's required vaccines at age 11 and age 16.
So can you list some of the major vaccines that are given?
This past year, the hepatitis A is a major vaccine that was changed for CDC, so that one is given for school aged kids. The meningococcal is also another one that's a major vaccine that we give and that's required. Hepatitis B, and then the Tdap is also one that's required.
Okay. What vaccines are offered for the staff?
All vaccines are
All of
offered
them?
for staff, and of course flu shots are also offered for all staff and students.
All right. All right, so at the clinic this year, what kind of vaccines do you guys offer?
We offer all vaccines for, like I said, the children under 19 who qualify for the Vaccine for Children program. And we also do some adult vaccines, such as the Tdap. And we were very involved in the recent hepatitis A outbreaks in getting adults immunized as well. And the hepatitis A, as she said, you know, that requirement begins at age 1. They can get their first hepatitis A vaccine, but we catch up children who have not had that vaccine in the past.
Do guardians have to be present for a vaccine to be given?
Yes, parents preferably, or guardians of children, and we ask for those documents signifying that.
In the school base, they do not have to be present. As long as we have their consent, they don't have to be present to get the vaccine at school.
When will HCEC flu clinics be?
In October.
October.
We'll come to all the schools in October. Any parent who signed a consent for their child to get the flu vaccine, we'll give them in October.
All right, so what about parents that don't want their kids vaccinated?
We do have parents who don't want their kids to get vaccinated, and that's okay. We do have a medical exemption that they could choose not to give their child a vaccine if it's medically indicated. If there's paperwork, of course, to fill out for that, but also for religious exemptions. If they have a religious reason why they don't want their child to get vaccinated, they can fill out the paperwork for that too.
We try to educate all our parents on the good practice of vaccination. I mean, we're preventing disease and we're about public health, so we're protecting not only that child and that child's family, but all the community as well. And with the increase of international travel, I mean, these diseases are just a plane trip away, literally. So it's very important, and sometimes education is the biggest thing that we can do.
Are there any side effects to vaccinations?
There can be. Some of the most common side effects that we see are a slight fever after vaccination, and also redness, pain, swelling at the injection site. Those are some of the most common, and they can be easily taken care of with Tylenol or tea bags to the injection sites work really well.
What vaccines cover chickenpox and measles?
So the chickenpox vaccine is varicella, is the name of it, and then the measles is the MMR. So it's measles, mumps, and rubella. So those are the two vaccines that would cover both of those.
And what about individuals who wouldn't have received that vaccine?
They can receive those vaccines. With the recent outbreak of measles, as you've probably heard about, we did do some adult vaccinations of measles in the health department, and we gave the measles, mumps, rubella vaccine for that.
What vaccine should adults be getting at this age?
If they have not been vaccinated for the tetanus or whooping cough, that is one that they need to get. It's called Tdap. So it covers them if they haven't had a tetanus shot in the past 10 years. They do need to get that. It also protects them, and if they're around any children, their pertussis, it protects the children from getting pertussis. Also, hepatitis A is one that a lot of adults haven't received, so I would suggest getting hepatitis A for adults also.
I'd like to add that the Tdap, the tetanus, diphtheria, and pertussis vaccine for adults is very important in pregnant women. Mm-hmm. Pregnant women should receive a dose of Tdap with each and every pregnancy. And this protects the fetus, the newborn baby, from pertussis. And you know, we've had recent outbreaks of pertussis also, so that's very important. And also anyone, caregiver, family member who's going to be around that young infant should receive that Tdap vaccine also if they're not current on that. Like as she said, if they haven't had a dose within 10 years.
Why are these vaccines so important for adults?
Well, to prevent outbreaks of disease, obviously, and you know, like I said, with the recent outbreaks of whooping cough and measles and hepatitis A, vaccines are becoming more and more important as the world travels. People coming from all over different countries, so it's very important. And like I said, you're not only protecting your child or yourself, but you're protecting your whole community. So.
And I would like to add another one for the adults to get is the pneumococcal.
Right.
It protects them from getting pneumonia. So that is one that adults should look into getting also.
And with flu season coming up very soon, we are strong advocates that everyone receive their flu shot beginning at 6 months of age. The flu can be deadly, especially in young infants and the elderly whose immune systems are not up to par. So please, everyone get their flu shot.
Are there any more important vaccines that people should be getting right now?
There is one, it's not required, but is highly recommended. It's called the Gardasil, which protects against HPV. It is a vaccine that can protect against cancer. So children should be getting that starting after the age of 12 and 13.
In our clinic, we start administering the HPV vaccine at the age of 11, as early as 11, because you want to get them vaccinated before they become sexually active. You know, there's certain high-risk strains of the human papillomavirus that cause cervical cancer, throat cancer, anal cancer. You know, even males can take the HPV vaccine, and so we strongly encourage that.
It's the only vaccine out there that prevents cancer, so that's why it's highly recommended. Why not get your child vaccinated?
All right, thank you both so much for coming today. We enjoyed interviewing you.
Thank you for joining us for this first edition of EC3 HOSA Medical Moment.